the Facts at 5. I'm Michael Clark here at LTV Studios with Morgan Vaughan to fill you in on what is happening in the town of East Hampton and beyond. And of course, we are mostly focusing on the dramatic upswing in the COVID cases in the area. Good afternoon, Morgan.
Good afternoon, Michael.
So let's start with some numbers, some charts, some fun things. What's going on here?
Okay, well, here is the chart that we were just talking about. This is from Suffolk County, the Suffolk County Board of Health, and this is showing what we're experiencing here right now. And I think I put in the document that we're sharing the stats that go along with it, but this is the other day. This is, well, is that Monday? Yeah, Monday.
Monday.
So we're almost where we were in April. And as we were talking about yesterday, we haven't really hit the Thanksgiving bump yet, which I was surprised when you mentioned yesterday that Fauci said that could be January.
Mid-January, he was saying, yeah. And what's also amazing, I think, about the chart is the fact that it's nearly identical the way that they projected the chart to be.
Right.
Not that there's any fun in that, but you know, they called it. That's for sure.
Well, and also notice here, this 8081. So that's just after is that after, no, maybe not. Where's the holiday? Because this is after Memorial Day weekend, this little spike right here.
Right.
So this is after some kind of thing, I'm not sure. And this is maybe after, what was that? Columbus Day weekend. I think that was that bump. Right. So we see that what they were talking about yesterday, that Cuomo's been talking about, that Fauci's been talking about the small gatherings are really the instigators. And that's good news, as you were saying, for gyms, etc., because maybe those places are safer really than having your friends and family over for dinner.
Right. It's
not that I don't know that, and I'm not going on record saying that. However, it seems like that's what we're discovering, because otherwise those other numbers would be higher in the middle, because those are going, you know, your regular life.
Right. You could also use it to your benefit if you don't like your friends and family. You don't want them coming over. I mean, that's one advantage, right? But the the small gatherings that you know, they were talking about, it's project what 70%, I think, was the number that we mentioned yesterday that were tied to these small family gatherings, or you know, just a couple of people getting together. So it's all got to be we got to be very careful.
I think I'd like to do a story that maybe we can think about this week about what to do over Christmas. Maybe there's some things that we can work out with the community about how to feel connected over Christmas and over, I know Hanukkah starts, I think, next week. And I know that that's not a really big Jewish holiday, but you know, this time of year, we all want to be connected. Maybe we can figure out ways, or we can ask in the community what people are doing to, you know, feel connected during this time of year.
No, absolutely. We definitely need that. But to touch back on the, you know, what's going on and why, you know, COVID continues to surge. Governor Cuomo reported out yesterday that an Amagansett establishment was one of 6 bars and restaurants on Long Island to have its license suspended by the New York State Liquor Authority recently for violating coronavirus regulations. The Best Pizza and Dive Bar, which is located on Montauk Highway in Napeague, had its license suspended on November 18th, Cuomo said. The 6 on Long Island were among 36 statewide to see suspensions. More than 280 establishments statewide have seen their licenses suspended for violations of the governor's executive orders, a recent release said. So on November 15th, apparently some plainclothes officers from East Hampton Police Department entered the establishment, saw about 20 patrons, standing around the crowded bar, mingling, ignoring social distancing, and not wearing facial coverings. And that particular establishment is a repeat offender with charges brought by the SLA just a few days earlier for violations of the executive order based on a referral from the East Hampton Town Police Department. So, they're out there, they're trying to govern this the best possible way that they can. And, onward we go.
But that's the thing. It's really up to us. It's
Right.
really up to the community. We can't, these cops can't do everything everywhere. And it's really incumbent upon us at this point. We know what's going on. I feel that we should understand the gravity of the situation. But maybe some people, but we all want to believe it's not true too.
Yeah, and let's face it, 20 people isn't a lot of people, in an establishment, right? But if you don't have the mask on, you're not practicing social distancing or, whatever is required,
It's dicey.
and then on the business side, they're doing whatever they can to stay open, right? They're trying to survive. So, I think we all get that. And one of the other professions is the fishermen. And I think we have some news on that.
Yeah, we have that the local fishermen obviously have been hit hard by the pandemic, but they hopefully will soon be seeing relief in the form of direct payments. So Governor Cuomo recently announced that $6.7 million in federal funding is available from Marine Fisheries Relief Program established by the CARES Act. So eligible seafood, commercial marine fishing, and marine recreational for-hire fishing businesses will be able to apply for the funding through December 30th. So I'm going to put all of that information, probably it's right now, you will see it. But I will say also right now that you email fisherydisaster@dec.ny.gov or you call 631-444-0473. And so this is to help people who have been our friends and neighbors and our fishermen and fisher people who have been affected by the pandemic disaster.
Okay, and for all you folks out there also, the town of East Hampton is communicating daily on our crawl. When we use that term, the crawl is those little things that crawl across your screen, while something is playing. And on the crawl daily, there'll be messages from the town regarding COVID. Yesterday, in case you missed it, the crawl was COVID-19 cases in East Hampton doubled in the last 7 weeks to more than 550, and the county-wide infection rate is more than 6%. Stop the spread, mask up, maintain distance from others, and wash your hands often. So that was the message yesterday. There'll be more today. And when is that played, Morgan? The crawl?
The crawl, there's 2 crawls, but they play essentially at the 15 minutes. So at 1 hour, at 1 hour 15, at 1 hour 30, 1 hour 45, and then the next hour. So
Okay.
every there's a reminder on both channels.
Right. And what's going on with the vaccine?
So with the vaccine, what they're saying on the New York State coronavirus website, which is a great one, the first COVID-19 vaccines are coming soon. New York State is expected to receive an initial delivery of 170,000 doses developed by Pfizer, and they anticipate that to start vaccinating the first group of New Yorkers by December 15th. Healthcare workers and nursing home residents will be the first groups of people to receive the vaccines. And this is lightning fast, as we all know, for vaccines to get out there. But I don't think that there's many healthcare workers who are saying they will not take this vaccine. They are desperate for some relief and some protection. They are, I was listening to NPR, to WLIW as I came in today, and the hospitals are overwhelmed and they are losing people, doctors and nurses every day, not by necessarily they're dying, which some of them are, but because they have to be quarantined. So they're taken out of work. So then we're losing the people who are actually taking care of the people who are the sickest. So this is one of the reasons why we are protecting each other by staying home, et cetera. But 170,000 doses is not a lot of doses for the entire state of New York. I'm sure that the governor and the state of New York is doing all they can, but this is obviously lightning fast considering that they think maybe the earliest cases were sometime last year at this time. So this is pretty fast, and we're hoping that it will be successful, obviously.
But when I was talking to Peter recently, Peter Van Squack, that is, he was saying that we probably wouldn't even be feeling the effects of this where they can kind of lift some of the restrictions until, sometime in midsummer, end of the summer. So, we got a ways to go. There's hope on the horizon. But again, folks, it's really up to us. We need to be the ones to, you see somebody without the mask, tell them to put it on. You have a store, make them wear a mask coming in there. Do whatever we can to protect the other guy. And that's pretty much the main message, I think, that we need to spread here.
Yeah.
So
Message we need to spread, not the virus.
that's right. Thank you for clearing that up. And all right, anything else, Morgan? I think that might be it for today, but
That's it for today. I hope that we can offer a little bit of clarity, and if anybody has any ideas about what we can do for everybody to help the community in terms of feeling connected and making it a little bit normal, that would be fantastic. Please send to info@ltbeh.org or to Morgan@ltbeh.org or Michael Clark @ltbeh.org.
that's right. Thank you, Morgan, and I appreciate that. And I will see you same time tomorrow.
Same time tomorrow.
See you. Have a good night, everybody.